Hello everyone, I'm Dr. Chandan here. Today I'm going to share you the most important topics in surgery which you must know before you appear for FMGE exam. Guys, surgery is the subject which is extremely important. So you should definitely keep in touch every day by doing at least 20 questions. Guys, I went through the last 11 papers of FMGE and I have selected the topics which are repeated in multiple exams and which are expected to be asked in upcoming exam. So please make sure you don't miss any of these topics. So let's start the topic now. First we have head trauma. It is very important. In head trauma you need to know subdural hemorrhage, extradural hemorrhage and subarachnoid hemorrhage. You have to know the investigation and you have to know, by looking at the image, you have to identify the diagnosis. Now tension pneumothorax, almost in all the exam we can see this question. So revise this effectively. Then hypovolemic shock. Then abdominal trauma. Know the investigation both in stable condition as well as in unstable condition, how we will manage the case. Then skin grafting. We should know like all the allograft, autograft, isograft, whatever the graft we have, and partial thickness and full thickness skin grafting. Know very well about the skin graft. There is a chance that they can ask. Then fistula in ano, you should know. Then we have foreign ears gangrene. Then we have perianal abscess. Guys, for surgery, whatever the resources you are using, definitely they have been covered most of the important topics. So what you have to do means you have to revise those topics very much effectively with the multiple revisions so that you can able to boost your score. Don't think the information is not sufficient in the notes you have provided. That is very much sufficient. Just make sure you revise those very effectively. And if you could not able to find some of the topic might be in your notes, then you might be see those questions in those topics when you are solving the questions. So learn that time very effectively. So let's see the next topic. Like we have renal cell carcinoma and nephroblastoma is again very important. We have BPH, benign prostatic hyperplasia, again important. And we have coronary artery bypass grafting. We have kidney ureter bladder stones, or the types of stones, as well as investigation you should know. And bladder cancer is also important. Know the treatment also, know the this one. And acute pancreatitis we have. Then anterior mediastinal mass. We have atherosclerosis, like you can also learn about Burgess disease. Then breast cancer is important. We have prostate cancer, which is again extremely important. Varicose vein is again important. And aortic dissection, you also see this in case of medicine, so it's very important, aortic dissection. And von Hippel-Lenoir disease, it's important. Ecclesia cardia we have. And GERD. Acute appendicectomy is again important. Undescended testis we have. Tubercular lymphadenopathy. And keloids and scar. Okay, and keloid is extremely important. And Peyronie's disease, congenital diaphragmatic hernia, and paralytic ileus, and gallstones, paraumbilical hernia, gas under diaphragm, basal cell carcinoma, and know about squamous cell carcinoma as well, testicular torsion, acute cholecystitis, Mallory Weiss tear, and DVT, deep vein thrombosis, cleft lip and cleft palate, and post-Sabal syndrome, which is also known as dumping syndrome, again important, and bladder trauma is also very important. So these are the topics which are easy to score. Make sure you revise them effectively to boost your score and keep solving the questions every day. Thank you.